And if you want to turn off your video, feel free to do so at this time. And please do mute yourselves during the presentations. We have just 1 hour for this great set of panelists for the presentations as well as the question. Each speaker will speak for 5 to 7 minutes, and in between each speaker we'll allow for 1 question if time permits. And then at the end, the panelists will address questions. So please do put all of your questions and comments that you have in the chat, and then we'll try to address as many of them at the end of the presentations. So let me just do a brief introduction of our panelists and the order. Dr. Gregory Bass, who is the director of the Health Careers Program and chair of Environmental Health Sciences Program, has been trained as both a researcher and a physician. She actually served as a chief resident. She will begin the discussion about health literacy. Following Dr. Gregory Bass will be Dr. Jelks, an environmental engineering by training, who received a master's degree in public health, and she investigates urban environmental health disparities. She will discuss spatial, racial, and social disparities. We will culminate with our resident environmental justice expert, Dr. Fatima Shafi, Chair of Political Science Department, who also serves on the national level as a member of the US EPA's National Environmental Justice Advisory Council. So without further ado, I would like to turn it over to Dr. Gregory Bass.
All right. If you all could let me know if you see a thumbs up, or if you can see the slides, if you can give me a thumbs up, that would be great. And I'll go ahead and get started. Just want to really thank you all for taking the time to come this evening to our webinar or our panel discussion for a topic that is really near and dear to me as it relates to COVID-19, and especially the topic centered around prevention practice and the importance of health literacy, because I find in my many conversations with individuals, they are just starved for information because this has been a condition, a pandemic that has really stopped everyone in their tracks. There has not been one aspect of our society or individual who has not been impacted by this. So I just wanted to share a couple of words to get started, and again, thank all the organizers in the TRRC for allowing us to have this time this evening to share this information. So COVID-19, as you know, has a number of different nuances. I know that we've, as mentioned by Dr. Ennis, have had conversations around the science and vaccination potential, as well as the historical aspects in terms of how it is impacting our society. And today, I just wanted to take a little bit more time to really highlight what are the things from a preventative perspective that we have been able to accomplish, but then are still challenged by. And then also being able to look at practice, especially from a clinical perspective, what has been so helpful and what do we still need to do? And all of that is going to impact how individuals walk away with information that will guide what they do individually as well as collectively in their communities. So when we think about COVID-19 and its impact, we know on a day-to-day basis, there has been information that is being shared with us. Some may even say it's information overload. But I try and just keep track no more than probably 3 times a week, or I should say no less than 3 times a week, to find out how are trends and how does that dictate my own health behaviors. As it relates to today, we are up to a total number of cases ranging, or not even ranging, but at 4,351,997 cases in the United States. And to know the number of cases, it is in itself just one aspect. But I think when we look at the gravity of the situation and understand mortality associated with the pandemic, that gives even more depth and breadth to our understanding of the disease. And so when we look at our total number of deaths in the United States, we're up to 149,256 deaths. And I don't know about you all, but when I think about other conditions and disorders in this time frame that we've had, that is such a significant number. And the reason why I think many individuals would find it significant is because of perhaps our inability to be as prepared as we could have been, and that perhaps many of these deaths just could have been prevented if we had just had the preparation to have the necessary equipment or the understanding of the disease at a level that would change health behaviors and health practices. So with that being said, some may be curious about Georgia. And right now, Georgia is still considered to be a hot spot, with us having a total number of cases, approximately 175,000 and 3,563 deaths. So we are ranked 16th in the nation when it comes to that. Our geographic disparities, oftentimes when we look at these maps, we have been able to see that there has been a shift and change where it started perhaps being heavily concentrated in the northeast. And then now we're finding that the South is where there have been higher numbers of cases that have been reported. And so not only the South, but also we're finding the Southwest, and particularly you'll hear quite a bit about Arizona as well as California. There's also been some conversations about, is it just the metropolitan areas, or are our rural areas also being impacted? And we are seeing that, at least in Georgia, I think many of you all know, even though Atlanta as a metropolitan area has been significantly impacted, early on, we had found that there were smaller communities such as Dougherty County, Albany, where there were a number of different cases reported and a high number of deaths. And then recently I was looking at news reports, and they had stated because of the season, with this being the summer, we're now seeing seasonal disparities that have occurred, where many individuals are used to us going on vacation, going to our coastal areas to enjoy beaches and other recreational venues. And we're finding that those areas also are now being heavily impacted, as well as our many state parks, our national parks. So for us to have an operational definition of prevention, it's very important to know that there are three different categories. There's primary, secondary, and tertiary prevention. And COVID-19, in order for us to really get a handle on the transmission, we find that authorities, clinicians, and even lay individuals are having to really employ all three of these preventions and not just one. Our primary is really looking at how do we actually intervene before we even have a problem or before a challenge occurs. And so that's when we're thinking about vaccinations. So some of you may not be familiar with measles, mumps, and rubella, because we've had a very strong vaccination program to make sure that we didn't have transmission of those particular diseases, or even, I should say, not even have any high incidence or prevalence in our society. Now, that's not the case worldwide, but we've been able to be very successful here in the United States. And so secondary is when we're really looking at, for individuals with high risk factors, again, what are we doing at a very early stage to monitor and prevent the onset of a condition or disorder? And that's where you see here getting mammograms for the prevention, or being able to early screen for breast cancer, blood pressure screenings as well for those individuals who are high risk. And then tertiary prevention is really how do we manage a disease to really decrease any morbidity or mortality associated with the pathophysiology of that condition. So I have found, in speaking with colleagues, that one of the main things around COVID-19 that is a challenge is the fact that it is a moving, invisible target. And I think it's been very hard for individuals in our society to understand how there is a connection between the PPE or personal protective equipment and the transmission of the virus itself. So when there's the conversation about literacy, there's just basic information needed, and that we need to do a good job of as individuals who may be clinicians, people at the federal level, disseminating key facts about how it is transmitted. What is the epidemiology? How is it actually manifests itself in the body? How is it going to present in terms of signs and symptoms? And then who are our most vulnerable populations, along with what treatment is available? And you'll see in the diagram here that the totality of the basic information needed, these letters just represent what you see on the left-hand side of the screen. We cannot have a conversation without understanding how individual communities are impacted by the social determinants of health, and that will play a role in the way that the virus is transmitted, present itself in a community, as well as how it is actually going to manifest from a biological and physiological standpoint. And we cannot forget how policy, our economics, our current leadership, as well as our personal choice and mental capacity to handle all of the challenges associated with the pandemic. And when it comes to practice, traditionally we've done evidence-based practice, meaning that we use the literature to inform what we do on the front lines. However, there are difficulties with this virus in that our leadership is just not necessarily always in concert with one another. And I think there have been many individuals who have stated that that's been a big challenge for us in our ability to get a handle on all that is taking place. And we look to the CDC, Health and Human Services, National Institutes of Health, and the White House to guide us in those perspectives about what is the best next step to take. And so that is one thing that I think clinicians are really doing their very best. And I think most of them, everyone on the front lines, is moving forward with trying to come up with a consensus so that the information shared is going to be consistent. The research outcomes as well has been a challenge. So for any of you who have been following, you'll find that there were even early studies looking at blood type and susceptibility. And so on June 17th, the New England Journal of Medicine published a study looking at blood type, perhaps determining morbidity and mortality of patients who contracted the virus. However, 1 month later, they found that it did not have as much of an impact, which was published in the Annals of Hematology. So I think that it will be important for us to continue to follow the research and make sure that there's due diligence in explaining things to individuals so that there isn't the development of patient confusion and mistrust. And again, age, race, and other comorbidities are going to be discussed by our panel. But I do know that that has also been a shifting conversation when it comes to COVID. And I'll finish up just by saying that the challenges with practice and implementation also are centered around cultural practices, hygiene practices, and mental health implications. And the CDC had a great diagram that they provided that was able to show the relationship between cultural empowerment, relationships and expectations, as well as cultural identity. And so for groups that really look at religious ceremonies, holiday experiences, and other traditions as a time to connect, a time to support, when we find that there is not necessarily the ability to have those types of engagements, it really can sometimes cause a strain. And when we do come together, what are ways that we can do that safely so that there's not going to be increased incidence and prevalence of the infection itself. And then the hygiene practices in terms of mask usage and hand washing have been pointed out as very important things. However, there are differences in the way that individuals are doing that. And I'll speak to the mental health implications during our Q&A. So the media as well, I just wanted to post how there have just been a number of things that have put in the media that can sometimes lead, I would call it media fatigue, where we're even finding individuals, because of some of the contradictory comments that are made, really are not interested in wanting to hear any more about it, and really just want to find out what are ways in which they can get back to their normal way of living. And so our health literacy around decreasing transmission, I think, is important. I have a colleague who's joining us this evening. Every time we talk, I talk about masks and how many times they are not being used correctly. And I'm sure there are some of you who have been out at the grocery store and other places where it's really just been a support for the chin and not necessarily being worn correctly, or there are masks that are not completely covering those areas where there can be release of the virus through water droplets or mucus, through coughing and sneezing. So it's good to have very good coverage. Face shields alone are really to just protect the open areas or orifices of the face. However, it should be done in concert with a mask and not alone. But here, this is, I just wanted to show this is good coverage. However, it's important to know that there's a specific design to the mask. So sometimes we've seen the individuals wearing the mask inside out, which is also going to be a challenge, but this one is on correctly with the blue side out. So thank you so much. This is just an intro related to prevention, practice, and health literacy. And as long as we continue to have conversations about what are ways in which communities are able to understand the information, I think the better off we will be in terms of there being follow through with appropriate health behaviors. So, thank you.
Thank you so much, Dr. Gregory Bass. We really appreciate that very informative presentation. And there were a couple of questions. So while Dr. Jelks brings up her presentation, I'll just ask you one real quickly for a brief response. This is from Dr. D.T. Pai. What needs to be the main message about this virus that people have not yet received or heard from their leaders?
This is something that I think that when I've spoken to individuals, and we've had this exact same thing, what is the bottom line? And I have this conversation with family as well as my colleagues in healthcare. The most important thing I think that needs to be understood, different than other conditions that we have a lot of knowledge about, I think honesty is important. We need to share with individuals that we do not know all the answers. We do not know everything in terms of how it is going to manifest. However, it is with the information we do have, there are some consistent things that we can continue to communicate. Number one, we know that this is a virus, and we know how it is going to actually go from one person to the next, which is why the basic information that has not changed about our social distancing and not being in heavily populated areas, our hand washing practices, as well as our ability to consistently wear masks, is just very important. We cannot tell people that we understand who is going to be more susceptible to fatalities and who isn't, because we've seen the very young and we've seen the very old and everyone in between. But I think as long as we can focus on those preventative practices that are really consistent with other infections as well, that will allow us to remain in a situation where we are at the primary prevention level versus having to then be at that tertiary level. That's to me what I've been communicating, and that's what a lot of my colleagues have also said, is to be honest about what we know and especially about what we don't know, and to continue those practices that we know are going to protect us individually and as a community.
Thank you so much for that. We appreciate that and want to thank you. Please continue to put your questions and comments in chat. I want to welcome everyone, especially our Provost, Provost Davies, who has joined for this forum. Dr. Jelks, we'll turn it over to you now.
Thank you so much. Can you all hear me? Let me just, okay, perfect. All right, so I want to talk and kind of build on what Dr. Bass talked about. She mentioned some of the geographic disparities, and so I want to talk about spatial, racial, and social disparities with respect to COVID-19. As an environmental health scientist, I'm particularly interested in communities of color, as well as low-income populations, and the relationships between the often disproportionate exposure to environmental hazards and stressors in those communities and poor health outcomes. In the field of environmental health, we know that residents of low-income and communities of color suffer disproportionately from negative environmental factors, including air quality, poor air quality, substandard housing, lack of healthy food options, lack of access to clean, affordable drinking water, and lack of clean, safe, open spaces such as parks, green spaces, and playgrounds. We can also look to other factors such as the lack of access to high-paying jobs, inadequate access to healthcare and other crucial services, as well as fractured social networks. So really in my world and in my area of research, place matters. And so now I want to kind of talk about a few things with respect to place. So number one, all places are not created equal. And then as we think about the disparities that Dr. Bass already talked about, whether we're talking about this pandemic or some other health condition, everything is spatial. Everything happens somewhere. Everything is also related, but things that are closer together are more closely related. And this is kind of one of the first principles of geography, which I think has some bearing on what we're talking about today. Disease frequency has been found to differ systematically across geographic areas. And there's also a growing body of evidence that points to zip codes as the single best predictor of one's health, future health and well-being. And we can look no further than Atlanta to find that to be true. There's a nearly 25-year difference in the life expectancy between people who live in the Bankhead or Donald Lee Hollowell Parkway corridor, which is in close proximity to the Atlanta University Center, and residents of the Vining community, which is just a few miles away in Cobb County. So this whole idea that place matters is something that many have been studying with respect to health for a number of years. We can, really look back to scholars like W.E.B. Du Bois, who really talked about environmental conditions and the conditions in neighborhoods around the Atlanta University Center and the prevalence of different types of diseases. He looked at things like, whether or not people had access to sanitation, poor drainage, and that sort of thing. So if that work was going on years ago, surely it's relevant today. So here are a few kind of titles from journal articles as well as newspaper articles over the past few months. When we think about how place matters in the context of COVID-19, the answers to this question are being investigated by health researchers, by nonprofit organizations, by journalists, and just by everyday people who are looking at the numbers and sort of scratching their heads about why there may be hotspots in some areas and not in others, and which populations are being severely impacted. The one title that stood out to me was this one that says COVID-19 has a postcode. And so this article is looking at how spatial inequality shapes the pandemic and how we might need to employ some place-based responses. We've looked at cities as well as rural areas, and Dr. Bass kind of referred to that. One of these studies talks about spatial inequalities and health outcomes in 3 U.S. cities. They looked at Chicago, New York, and Philadelphia, and then other other articles are looking at what's happening in rural areas, and we're looking at the fact now that some of the data may be hiding some of these hotspots in the rural areas in particular. But as Dr. Bass also mentioned, the numbers are shifting. So in the beginning, we were thinking just about large cities, but now we have to think about rural areas. We're now thinking about small metropolitan regions as well. And in terms of the current case numbers and infection rates, we can also look at things like policies in state and local governments. When we look at who opened back up really quickly after we had kind of widespread shutdown measures across the country, and we can look at that on a global scale as well. And we can tie perhaps some of those early reopenings to some of the numbers that we are looking at and seeing and experiencing today. So I have just a couple of maps. So this is one in which we're looking at the global distribution of COVID-19 cases. These numbers are from today. These are updated on a daily basis. And so again, these numbers are changing. This is a chloropleth map. And so on this map, you see the darkest regions of the map corresponding to the highest number of cases. And in this case, I believe this darkest sort of maroon color are areas where you have over 500,000 cases. When we look at the United States in particular, we'll see Georgia in the darkest color. We also see Florida, which has been talked about quite a bit, in Texas, California, Arizona, as well represented on this map. So let's talk just very briefly about how place might influence COVID-19 disparities. I'm really interested in environmental conditions. So with that, climate and weather extremes are something that we are beginning to look at really months into this pandemic. It's becoming very clear that environmental and climate factors are helping to shape the landscape in which COVID-19 proliferates around the world. So not just the United States, but it's also influencing the public health response to the pandemic, as well as interactions that may be taking place with respect to existing environmental health disparities. Climate and weather extremes may not only affect transmission of the SARS-CoV-2 virus, but also the ability of health systems to respond effectively. In the United States, we are moving into hurricane season, and so as the frequency and severity of extreme weather disasters increase, this pandemic, I believe, will illuminate special challenges to health systems with respect to the current events with COVID-19, as well as cumulative hazards and stressors. As we are entering this season of hurricanes, heat waves, tornadoes, the public health systems will be needing to deal with both this ongoing pandemic, as well as the health consequences that are associated with extreme heat and weather. And the interaction between these two might, really make certain communities more vulnerable. So not only in terms of where people live, but also in terms of where people work and where people play. So we can think about healthcare workers in terms of their vulnerabilities that might be exacerbated if we're talking about healthcare workers who are working in temporary facilities in some instances. As we think about heat waves and things like that, how do we protect people, especially those that might be in higher risk categories for COVID-19 if they have to move into emergency shelters or into cooling centers. So lots of questions in terms of risk mitigation and in terms of management from a public health perspective. Also, in terms of environmental conditions, there's a growing body of evidence that is showing that there are increased rates of COVID-19 in areas where there are high levels of air pollution. And I think Dr. Shafi is going to talk a little bit about this. There are some early studies that are showing that environmental factors like poor air quality have been associated with more severe health outcomes in infected individuals here in the United States. There was a study released by some researchers at Harvard University recently that shows that long-term exposure to fine particulate matter, what we call PM 2.5, is linked to higher mortality from COVID-19 than in areas where you don't have concentration of this fine particulate matter in high levels. Definitely there is some evidence to show that at least early on, when the country was sort of shut down and lots of people were sheltering at home, that we see some decreases in air pollution that comes from mobile sources, from our vehicles. But we also know that the Trump administration has relaxed a lot of the environmental standards for companies and for industry. And I know that Dr. Shafi will talk about that. And so that we don't know, but we definitely suspect that there may be some impacts as a result of that if those companies and industries took the administration up on the relaxation of those standards. We can also look at things like housing quality, slum conditions, especially as we look at things from a global perspective, and then working conditions. What environments do certain people work in, and are those environments conducive to spread of the virus? There are a few other place-related factors that we could talk about. We don't have a lot of time, but I'll just kind of mention them. Medically underserved areas, and we've heard in many situations where there has been this tension with respect to the number of ICU beds that have been available. And so, how many of those beds have been taken up by people who are positive for COVID-19 versus people with other underlying health conditions. We can look at poor and economically depressed communities. And so while this is kind of veering into the social factors, the social and the environmental overlay very well in lots of communities across the country and globally. We could look at numbers where there may be high areas of senior care facilities. I know as I looked into some of the data around Fulton County and some of the zip codes, including the zip code that I live in, some of the things that were driving those zip codes were the number of senior care facilities and assisted living facilities in those particular zip codes. And many of those facilities have been really hard hit, especially early on before there were more strict policies and procedures put in place. And we can look at things like farm worker communities in Florida. We can look at prisons. There have been huge outbreaks in prisons across the country. And then also, communities where there might be a high number of residents who work in facilities like the meatpacking industry or even mining communities as well. So in terms of the racial and ethnic disparities, we've heard a lot about that, on the news. Those numbers are kind of ever present with us. So there are substantial disparities in terms of hospitalizations as well as deaths based on race and ethnicity. In the United States, we're seeing clear patterns in terms of disparities around racial and ethnic factors. We see that COVID-19 is more prevalent and deadlier in U.S. counties with higher Black populations. And so some folks are starting to sort of disentangle other factors, because we could look at socioeconomic status, because we know that SES is kind of a close cousin to race, especially in this country where we have systemic racism that then also impacts inequalities with respect to income and other factors, other social factors. We can also look to underlying health conditions, but those are all still symptoms of systemic racism. So they're kind of coming from the same source. In terms of the social disparities, there is a lot of spatial and ecological analysis that is starting to be done with respect to what we know about populations, but we don't know in terms of individuals, in terms of when those cases are reported, in terms of COVID-19 positivity. We don't know anything about those individuals in terms of their poverty level, in terms of income, in terms of employment status, type of employment, if folks are essential workers. We don't know about educational attainment, but what we do know about the social determinants of health, and these are some of those social determinants that if we look at it from a population scale, we can see some overlap in terms of those communities alongside race, these social factors as well as environmental factors. So I'll stop there because I know that Dr. Shafi is going to pick up and kind of drill down on some of these, as well as talk about policy and how we really kind of focus on some solutions.
Thank you so very much, Dr. Jelks. This was very informative, a little bit alarming because COVID-19, like you said, is really making us all realize just the prevalence of all of the disparities and how important, like Dr. Bass said, that we do have health literacy and honest assessment of what's going on. So we sincerely appreciate that. While we wait, while Dr. Shafi brings up her presentation, there was one comment in the chat for you. Can you elaborate more on what you mean by fractured social networks?
Sure. In terms of the fractured social networks, in public health, there's a theory around social capital that relates to kind of our social networks. They could be familia networks, they could be kind of community networks, and definitely what we're seeing in terms of income inequality in this country. We can look again at Atlanta and begin to see some fractured social networks that date back to things like the breakup of affordable housing, of public housing, excuse me. And so how people have been dispersed to suburban areas who lived in, who lived in rural, not rural, but who lived in urban areas. Now they're being sort of exported to suburban areas, and people who are being pushed out of their neighborhoods because of gentrification and the displacement that is associated with that. And so you see a breakdown of the social networks that people tend to rely on for social supports that have been largely correlated with people's health, with health outcomes.
Thank you so much for that. So I hope you all are as excited as I am. This has been so informative so far. So Dr. Shafi, we look forward to hearing what you have to say. You have to unmute. Let's see if I can unmute.
And unmute. Unmute, sorry. Hi, everybody. It's great to see all your beautiful faces, and it's a tough act to go after Dr. Bass and Dr. Jeltz. I do my best. Thank you for the invitation. As you know, EJ is my passion, and I think that, so what I wanted to do was go over some of the basic and then get into the policies. What is, first of all, I know that people tend to use the word environmental justice, environmental racism, as if it is one word. No, it's environment. First of all, environmental justice is a movement. And what do we mean as environmental justice? What do you call it? A steward of environmental justice. What do we mean by environment? It is really expansion of what has been traditionally termed as environment. We say environment is where we live, where we work, where we play, where we pray, where we study, and what and where and how we eat. So we expand it. And then what is the environmental justice movement? It is coming three streams together: the civil rights movement, the environmental movement, and the economic and social justice movement. So it is very relevant to how we see the Black Lives Matter, COVID, and economic. What is environmental racism that environmental justice movement is trying to eradicate its long-lived legacy? Is environmental racism, as the godfather of environmental justice, Dr. Bullard says, is really any policy, practice, or directive that differentiates the effects or disadvantages, whether it is intended or unintended, individuals or groups and communities based on race. The reason you won't see the word intended, because there was a Supreme Case court that said it has to be intention to prove that. So, and it is some trace it to Warren County in 1982, the movement that brought it to the national attention. Some say that when Dr. King went to Memphis in 1968, sanitation workers, that's the start of the movement. And the word environmental racism was coined in the Warren County, and you can see people were arrested for PCP. I'm not going to go into these cases. I will have lunch with anybody that is interested to go over everything. And then race is the most potent predictor of where toxic waste and these locally unwanted land uses will end. And this is not me, this is studies after studies when they adjust for income and everything else came up with that race is the best predictor. This is a national study that was originally done in 1987, but then 20 years later, they saw that it still holds that race is the best predictor. These are recent studies that show that actually the top polluters that are responsible for 90% of pollution, they tend to cluster in low income and minority community. So we always talk about disproportionately of the threat. This one came up with exponentially elevated risk, double disproportionality. And then there is a story always when we talk about environmental racism is that, well, the industry were there, people went there. And then this is another study that, to answer the question of chicken or egg first. And this study showed that communities were there before the industry moved in and started polluting them. And there is also another dimension, which is unequal protection, that a lot of times we have the same laws on the book. However, when it comes to the implementation of laws, we see that there is a disparity. We call it unequal protection. And that there was a National Law Journal article study in 1992 that showed that even the fines are less, the consequences are less severe when the violation of environmental law happens in communities of color. And this is a study that was done by Dr. Bullard and Dr. Wright, where they looked at the national disasters and they saw that there is a consistent pattern of slower response to the disaster in communities of colors. Place does matter. I'm not going to go over it because Dr. Jack so eloquently went through that. Zip code is not only just predictor of health, but also financial status. Because and as Secretary of HUD said, this should be an address, not a lifetime health determinant, the zip code. We differentiate between two types of environment, one that promotes the health of the person and the other one that really inhibits. And what we see is that when we talk about the COVID and environment and health, there are several issues that comes. One is the sensitive subpopulation. We see that it has impacted elderlies in the nursing home. We see that it impacted the incarcerated people. We see that people with a pre-existing condition and also people with less access to food. And then we also see the economic impact of environmental racism, reduced value of their property, and lost wages. Cumulative impact is that most of the time, our regulatory machine is really broken because we really regulate each chemical in isolation from other chemicals. So a community is not really exposed to one chemical at a time, and we really need to take this cumulative impact of exposure to all these health threats seriously, if we are serious about addressing. The other one is the synergistic impact, because chemicals, I'm sure Dr. Chen will tell you that when you have two chemicals present, they may become more toxic, less toxic, but we never take that into consideration. Okay, why does Black Lives Matters resonates with EJ folks? When everybody was echoing George Floyd's "I can't breathe," immediately as an environmental justice advocate, I would go back to asthma and the disparity in terms of asthma. If you look at, this is from EPA data, CDC data. It's not any secondary source. And if you look at the disproportionate impact of asthma on African American community, both in terms of its impact and also in terms of mortality and hospitalization, you will see the stark disparity that Black children are more likely, 4 times more likely to be admitted in hospital. And then you can see it is deadlier for African American. And the other thing that I needed to put it in here is that it's really not biological. It really has to do where a person lives. So that is why we think environmental injustices is so crucial to address, because if you look at the characteristic of neighborhood, you can see. So I put that where you are, not who you are. And many of you also remember Flint and the lead poisoning. But many of you might not know Freddie Gray, everybody mourns because he was also killed by police. But many people don't know that he was already a victim of environmental racism way before his encounter with police, because he was one of the many Baltimore residents that was, even there was a lawsuit and he got some compensation for being lead poisoned. And he got, I think, 100-something thousand, but the Vulture company bought it from him for cash for 18,000. And he had a rap sheet of some criminal record. But if you look at what lead does to the person, you will see that his life was already pretty much decided by his childhood, where he was one of those statistics that was really exposed to lead. And you can see here that the level, what the lead does. And you can see that there was a report that was submitted to Congress that Black children sometimes in Chicago are more likely 12 times higher than average to have lead poisoning. So let me go to, first of all, I'm very upset because right now there is an issue with the data. What is happening is that we are not having the real data. In the midst of this pandemic, it took New York Times a Freedom of Information lawsuit to get CDC to release partial information, because the data that New York Times got was up to May. And we still don't have and even that, really a lot of information was missing. And also, if you see all the article, they focus on pre-existing condition. When you talk about pre-existing condition, it renders you helpless. Okay, this existed before, I can't change it. But then if you really look at the data, I have a pre-existing condition. I'm a diabetic, but I don't have to go to work in a meat packing. So I'm safe. So pre-existing by itself tends to put things out of context and make all these willfully blind policies and woefully inadequate response render harmless. We need intervention. We need paid sick leave so people don't have to choose between paycheck and their work. So that is where we need real policy action, real data, actionable data that we can do, because we have, later they can do that. We have the history is full of these stories of atrocities that have been committed against people of color. So we don't need that. And then on top of these, Trump administration has been notorious in rolling back all the environmental protection, most of them. There was an article in New York Times in December about 95 environmental laws that were rolled back under this administration that impact air, water, soil, everything that you think this is too much for this call. And then on top of everything, on 26th of March, they said that they are really gonna put enforcement of environmental laws on hold because industry is under a lot of pressure. My question is that if they are fully operating, why can't they comply with the existing laws? And that is one question. So that is we can see that this is really adding insult to the injury of the communities that are being disproportionately impacted by the COVID, rolling back the environmental laws and also stopping the enforcement of environmental law. One of the biggest assault that has on environment is now started is, I think last week, Trump was here for opening 75 or a project near Highway 75. And the reason is that he's trying to really gut the National Environmental Policy Act. This is the most comprehensive environmental laws on the book. And what it doesn't set pollution, even though the name is environmental policy, but what it requires is that all federal funded projects, that could be port, that could be highway, that they need to do environmental impact statement to look at what could be the potential environmental impact. There are provisions within that says that they have to really look at the indirect impact of this policy, this project, and also cumulative impact. Now the regulation is they are trying to gut those provisions. Why it is important, those provisions, is because say you are going to put a port in place. The port might not have immediate impact, but if you look at the indirect impact of the port, that means that it's going to increase the traffic, does pollution, then, or if you do the port, let's use that example, without literally looking at other project that is there that are already emitting disproportionate pollution, then you don't, under NEPA, you have to take into consideration how much pollution this adds. But if the new changes go into effect, then that's it. Then they don't have to worry about that. And then he's trying to also limit the environmental impact statement to 2 years, which means, again, another death toll for effectiveness of this NEPA. And we saw recently that the Keystone or the other one was because of environmental impact was stopped and the industry backed up. So why is so much rush in getting this into, into the book? Because the administration knows that there is such a thing of a law called Congressional Review Act, which is that if the rule is not finalized in 60 days, that Congress can reverse that rule. So they are trying to really have it done so the Congress would not have that 60 days window. And so that is, again, another way of impacting the community. This one, this was released after the New York Times was able to get some of the data that we can see the coronavirus per 10,000, and you can see the disparity. And this is when they adjust it across age groups. So for these communities, the Blacks, Latinos, and they didn't have the indigenous, is really, and half of that information was missing racial and other information. And this does not really have the surge that is now we see in California, where most of the victims are Latinos. And then this doesn't have to be that way. If you look at Spartanburg in South Carolina, look at the picture before. And then when this was a dilapidated community with a lot of dilapidated houses, no community health. And then people got involved and the policy came that was as a result of that. And they were able to move that surviving to a very thriving, as my friend Mustafa Ali says, to change. And then toward the solution, I think that we saw that last year before this, Milwaukee County had a resolution, racism is a public health crisis. We really need to face it. It is a public health crisis. It's just that, and denial is not in denial. We really, in Egypt, we need to face it and have actionable agenda to address it. And if you look at also, there is a good, wonderful things that are happening. Last year in June, I was invited for the first one-of-a-kind congressional convening on environmental justice stakeholders forum, which was hosted by Chairman Raul Grijalva and Representative Donald McKitchen. And they are really moving forward. And that was started, but it has accelerated now with the COVID. We just had one. I think I sent the invitation to the whole Spelman if they wanted to join. It was July 1st. It was a very productive forum. And they introduced this February the Environmental Justice for All Act, which is going to be a comprehensive environmental justice law. And another thing is that I will send you invitation. The next one is coming. Also another big improvement, because policy is at the key of change. To me, change happens by one vote at a time and one policy at a time. And if you look at it, finally, House came up with a climate report, climate change report. And if you look at that report, the other milestone of that report is that if you look at page 300 to 312, you see it's devoted to environmental justice. And again, that is really a big plus, because I think that if we get Congress to move forward with the resources and the tools that they have, it would be great. I'm gonna conclude with Dr. Martin Luther King, my hero, because he always talked about dreams, even though he was facing a lot of nightmares. So that's why I talked about those dreams of Congress. So let's finish with his letter from Birmingham jail, that progress can happen. And it doesn't happen by itself. We all need to do our parts. Thank you very much, and sorry.
No. What I have to say is amen. Thank you, Dr. Shafi. And it's 1 minute before 6. If you all can just hang on just for a few more minutes, we have an excellent question for you, Dr. Shafi. And this is from Dr. Peter Chin. He wants to know, do you have suggestions about how we can help stop the Trump administration from wrecking the laws and policies needed to help protect the environment and health for communities of color, especially Black communities?
Yes, support the representative, write letters to your congress and women, and also your senators, because if you recall, this administration have a tendency to make important announcement on Fridays. And if you look at all these regulations, they didn't catch any headline that he got it. Yeah, and as I said, there was one big article in New York Times in December. Since then, it has been updated and the number has increased, the environmental regulation that he got it to 100, because in December it was 95. And NEPA, I think this is the one we really need to get on it, because this was also one of the policies that was highlighted in the President Clinton Executive Order 12898, which was really the only nationwide environmental justice policy that highlighted that NEPA the environmental impact statement could be an opening for EJ community to address this proportionate impact of the policies. And the other one is the civil rights, the Title VI of civil rights that he invoked in that executive order. So by all means, please write letter to the representative. And in Georgia, I think one of the people, that Doug Jones, is horrible, if I can say so. We need them to listen. We need them to know that we vote. And the key right now is to make sure that the choice for people is not their life and their vote, as we saw in Wisconsin and some others. And I think that we can see the early signs of trying to disenfranchise the very people that have been severely impacted by the COVID. And one more thing, please, please, I know as we talk about precondition, talk about the exposure right now, the essential worker. Let's advocate for them, because precondition, if you have the luxury of working from home, it's not gonna impact you. But if you have to go in to work day in and day out, it will impact you. One more thing, there is another whammy that is coming, which is the hazardous waste, medical waste, and corpses that are coming as a result of COVID. And there is a community in South Carolina that is advocating. Omega Wilson, and he's working with some of us at a subcommittee at American Public Health. Last year, we were able to draft environmental justice statement for American Public Health, and Dr. Jelk was part of that. And we are right now having, we had a town hall meeting about getting American Public Health to declare racism as a public health threat. And we got them on board about climate. We hosted at Spelman 2 years ago. I hosted, and Dr. Jelk was part of that. We hosted a summit before American Public Health Association meeting called Climate Justice at Spelman. So we are hoping. And another good news is that I had a conversation yesterday on a call with Environmental Justice Health Alliance for Chemicals Safety Policy, which is an organization I have worked with several years. And Chris Esposito, who is the Director of Public Relations of Chairman Raul Guijavar, the chair of the House Committee on Natural Resources. And he was talking about having a forum on environmental justice. And I invited him to Spelman, and he was very excited. So we are gonna probably host the inaugural congressional forum on environmental justice soon. I will send you the information as soon as I have more detail.
Yes, excellent. Please do send us this information. And so there's something that Dr. Shafi just said. She said environmental racism is a public health crisis. And she said, I'm upset, and I think we should all be upset based on the information that was provided today. It's our call to action. It's our call to social justice. Cynthia Neal Spence with the Social Justice Fellows, you know, we are in this together. And so we have to combat the systemic racism, the environmental racism, help enhance health literacy, and vote. So thank you, thank you, thank you for joining. This has been so wonderful. Akiba Harper said that this should be 2 hours, and I am inclined to agree and invite students, but I want to thank all of you for joining, and please join me in giving a very big hand to our outstanding panelists today. And so before we depart, Provost Davis, do you want to say any parting words before we depart?
Oh, thanks. I don't want to hold people up, but that was just terrific. And I was thinking the same things, but I wished our students had been able to listen. I have a million questions. It was a joy to watch so many questions and comments, and firing up the chat space too. It's you know, so timely. I'm so pleased that the faculty is doing this. And I appreciate all of the presentations. I really want to know some more about why so many of you are talking about concerns about the data, the reliability of the data, the accuracy, because we all know if we can't rely on the data, it's you know, and already the data is as alarming as it is. If that's telling or undertelling the real story, that's a real problem. So thanks for all of the food for thought, and Tasha and the TRRC. Thank you so much, Dr. Pai, for hosting, and Gilo as well. I really enjoyed it.
Yes. Thank you. Thank you to all of you. Please stay safe. Please stay well. And remember what you learned today. This is our call to action. Take care.
Another twist with the data, I don't know if you followed, is that they are now moving the data from CDC to another a private entity, and that is another disaster. Oh gosh.
Yeah.
You were fabulous. This was wonderful.
Thank
Dr. Ennis, you are fabulous. I can't believe how many exceptional moderators we have on this campus, and the content of the presenters. There's so much knowledge and talent at Spelman. It continues to amaze me.
Yes.
Thank
Thank
you
you.
for
It was fantastic. All of you were fantastic. Thank you so much.
thank you.
Sasha, I especially enjoyed your closing comments on, you know, call to action. So thank you for pumping me up, and thank you.
Thank you. Thank you all. You have a great evening.
All right, you all
Y'all
take
too.
care.
Thank
Thank you
you.
for organizing, Gila.
Of course, Peter, great groundwork. And I saw you put in the comments for them to be on the lookout for updates about what will happen next. So
Terrific job, Tasha. I mean, fantastic moderation. And I loved all three presentations.
Yeah, they were
Really
fantastic.
terrific. What a wonderful way to end the forum.
It was really good.
Thank you so much.
Yes, thank you again.
Thank you.
Take care.
everyone take care, be safe.
Bye.
Bye-bye.